Let's discuss organ relationships, specifically heart and lung and heart and spleen. The relationships among the lung and two organs. So first we have the heart and the lung. Key points here. First, its physiological aspect. Then about the pectoral chi, wherein the heart governs blood and vessels, while the lung dominates chi and governs respiration. Next key point is on blood circulation, where the heart governs the blood circulation, while the lung links with all the blood vessels. The relationship between the heart and the lung includes two aspects. On the one hand, the heart governs the blood, while the lungs govern the chi. On the other hand, the heart governs blood circulation, while the lung governs respiration. Physiologically, blood circulation depends on the propelling of heart chi and the assistance of lung chi. Lung chi also depends on heart blood because heart blood helps to distribute the lung chi through the whole body. If the blood circulation is normal, respiration will be smooth and regular. Pathologically, deficiency or stagnation of lung chi will lead to stasis of heart blood with the symptoms of palpitation, cyanosis of the lips, and a purplish tongue. Insufficiency of heart chi or stagnation of heart blood will lead to deficiency of lung chi or the rebellious lung chi, which is characterized by cough, asthma, and chest oppression. Now let's move on to the heart and the spleen. The key points here. First, it's physiological relationship where in blood circulation, heart governs blood vessels and spleen controls blood. The relationship between the heart and spleen are presented in the areas of blood generation, blood circulation, and emotional aspects. Physiologically, heart governs the blood and stores the spirit, while spleen governs the blood and is the source of blood. Therefore, the heart and spleen has close relationship in regards to the generation and movement of the blood. When the functions of the spleen chi are normal in transformation and transportation, and the production of blood is abundant, it will support the heart and stabilize the emotion. When blood circulation in the vessels, when blood circulates in the vessel, it not only relies on the movement of heart chi, but also on the support of spleen chi so as not to let the blood spill outside the blood vessels. Pathologically, if the spleen loses its function in transformation and transportation, which leads to insufficiency of blood generation or blood loss, it will result in heart blood deficiency. On the other hand, overpensiveness will lead to deficiency of heart blood and spleen chi, which will eventually result in the deficiency in both heart and spleen. Thank you for your attention.
We shall continue with interviewing for eye pain. These are the patterns for eye pain. First, we start with full. Wind heat is characterized by acute onset, aversion to cold, and fever. If the eye pain is due to liver fire, there will be red eyes, thirst, bitter taste, wiry pulse. If eye pain is due to liver yang rising, we'll have headache, eye distension. Heart fire eye pain will have red eyes, palpitations, and anxiety. Liver wind eye pain is vertigo. Damp heat eye pain will have sticky eyelids, sticky yellow tongue coating. Eye pain due to phlegm heat, you'll have sticky eyelids, feeling of oppression of the chest, dizziness. Eye pain due to blood stasis, bulging eyes, dark complexion, purple tongue. For the empty or deficiency conditions, eye pain due to liver blood deficiency will have accompanying dizziness and blurred vision. If the eye pain is due to heart blood deficiency, there will be insomnia, poor memory, palpitations. Kidney deficiency eye pain will have dizziness and tinnitus. Eye pain due to deficiency of qi and yin, slightly hot and painful eyes, mild pain, desire to shut eyes, red eyes, tiredness, and dry eyes. So for hot and painful eyes, we have the following differentiation. Liver fire will have hot and painful eyes, bloodshot eyes, headaches, dizziness, tinnitus, irritability, propensity to outbursts of anger, red face, thirst, bitter taste, constipation, dark urine, red tongue with redder sides, and dry yellow coating, wiry, rapid pulse. The points to use are liver 2, Li11, Li4. For hot and painful eyes due to heart fire, there will be accompanying red eyes, redness of the inner canthus of the eyes, burning sensation in the eyes, palpitations, thirst, mouth and tongue ulcers, mental restlessness, feeling agitated, insomnia, dream disturbed sleep, feeling of heat, red face, bitter taste, red tongue with redder tip and yellow coating, and an overflowing rapid pulse. Acupuncture points, heart 8, Li11, Li4, and heart 5. For eye pain due to liver yang rising, aside from hot and painful eyes, there will be feeling of distension of the eyes, headache, dizziness, tinnitus, irritability, propensity to outbursts of anger, wiry pulse. Painful eyes, which may not necessarily be hot, due to liver wind, will have tremors, severe dizziness, tinnitus, headache, numbness of limbs, tics, stiff, deviated, or moving tongue, and wiry pulse. Hot and painful eyes due to damp heat in the head will have sticky eyelids as well, heaviness of eyelids, sticky taste, facial pain, sticky yellow nasal discharge, a feeling of heaviness of the head, thirst without desire to drink, feeling of heat, dull yellow complexion, sticky yellow tongue coating, slippery rapid pulse. Hot and painful eyes due to phlegm heat, sticky eyelids, blurred vision, feeling of heaviness and muzziness of the head, feeling of heat, red face, greasy skin, feeling of oppression of the chest, sputum in the throat, expectoration of yellow sputum, dizziness, nausea, red and swollen tongue with sticky yellow coating, slippery rapid pulse. Painful eyes due to blood stasis in the head, dark rings under the eyes, headache, dark complexion, bulging eyes, mental agitation, tongue is purple with a wiry pulse. For liver blood deficiency, there will be dull ache in the eyes, which may not necessarily be hot. Blurred vision, floaters, dizziness, numbness or tingling of the limbs, scanty menstruation, dull pale complexion, pale tongue, choppy or fine pulse. Dull ache in the eyes, not necessarily hot. Due to heart blood deficiency, will have dull headache, palpitations, dizziness, insomnia, dream disturbed sleep, poor memory, anxiety, propensity to be startled, dull pale complexion, pale lips, pale and thin tongue, choppy or fine pulse. Dull ache in the eyes, not necessarily hot, due to kidney deficiency, will also exhibit dull occipital headache, blurred vision, floaters, dizziness, tinnitus, lower backache, poor memory. Other manifestations, including tongue and pulse, depend on whether there is kidney yang or kidney yin deficiency. For deficiency of Qi and Yin, slightly hot and painful eyes, mild pain, desire to shut eyes, dry eyes, slightly red eyes, dizziness, tiredness, dry throat, loose stools, poor appetite, pale tongue or normal colored tongue without coating, weak or floating empty pulse. For invasion of wind heat, the eyes will be hot and painful with sudden onset, red eyes, aversion to cold, fever, cough, sore throat, stuffed or runny nose with yellow discharge, headache, body ache, slight sweating, slight thirst, swollen tonsils, tongue slightly red on the sides, in the chest area or on the front part, and floating rapid pulse. Thank you all for listening.
Let us talk about Yang Shen, number 3. It is important to remember that not everyone is familiar with the foods that we recommend. We may have eaten tofu all our lives, whereas a patient has never even heard of it. Furthermore, a patient living in the countryside will often not have the same access to the variety of foods that are available in a large city. This means that we must be realistic in our dietary advice, tailoring and modifying it so that it is relevant to each individual client. It can be difficult also for a person to alter their diet radically when they live and eat with other people. For example, a husband and two children. Even though they are willing to change their eating habits, the rest of the family may not have the same motivation. It can complicate the situation if several members of the same family are being treated and they have patterns of imbalance that require conflicting dietary approaches. And some people find it difficult to change a diet in an appropriate direction due to ethical principles. This could be a vegan patient who is extremely blood deficient. Our job is to educate people about the causes and effects of, as well as the possibilities to positively influence their imbalances. They can make their own choices, and we should not be the judge of these choices. Our advice will often conflict with a person's desires and passions. As it was written here, I think it is important that we present people with information that can improve their condition. But from then on, it is their own choice. This is especially important when people do things that, from a Chinese medicine perspective, are detrimental to their health. They often do these things because they give pleasure or because, in fact, they help to ameliorate another pattern of imbalance. Some people, for example, do excessive physical training because it relieves their liver qi stagnation. If they did not exercise as much as they do, the symptoms and signs of the liver qi stagnation would be accentuated. This creates a conundrum if they are simultaneously liver blood deficient. The excessive physical training relieves their liver qi stagnation, but is also an etiological factor in their liver blood deficiency. It is also a complicating factor when inappropriate behavior or diet are sources of pleasure and enjoyment. By stopping someone from drinking a glass of red wine in the evening or running 20 kilometers in the woods 3 times a week, we remove something from their life that is nourishing their heart qi. In these cases, it is important to try and find something else that gives them pleasure or something that they are passionate about, so that we do not exacerbate or create a new pattern of imbalance in their heart. A person with spleen qi deficiency will often have a very sweet tooth. Their craving for sweetness will make it difficult for them to avoid eating sugar, sweets, cakes, honey, dried fruit, and so on. They could also have a heart imbalance. That means that they comfort eat those sweet things. It is important that the patient does not feel that we judge them. They are often very good at doing this themselves without our help. It is, of course, a balancing act, trying to be strict enough that they adhere to our recommendations, but at the same time not creating feelings of guilt and inadequacy when they don't succeed in doing what is best. We must find a way to support and help them without feeling judgment on our part. Thank you so much for your attention.
Let's now proceed to diagnosis according to Sanjiao theory with the pattern wind heat invasion in Upper Jiao. Diagnosis according to Sanjiao theory was developed by Wu Ju Tong. While he lived, his home region was affected by many epidemics, including measles, scarlet fever, and smallpox. This meant that he focused his energy on the study of infectious diseases and used the four-level diagnostic model as his starting point. Diagnosis, according to Sanjiao's theory, was not exactly a new theory, but more another way of utilizing the diagnostic model of the four levels, where the four levels analyzes the progression of disease in relation to their energetic depth and severity of the symptoms. The Sanjiao model utilizes a more two-dimensional analysis of the body. In this model, disease is differentiated from where in the body the disease is located and in which jiao the affected organ are located. When exogenous pathogenic qi is in the upper jiao, the wei qi, lung, or pericardium is affected. This is equivalent to the wei, qi, and yin levels respectively in the four-level model. The patterns are seen when exogenous pathogenic qi affects the yang organs and the spleen. This will be similar to the qi level heat in the four levels. The lower jiao patterns are the most serious. In these patterns, the exogenous pathogenic qi has affected the kidneys and the liver. This corresponds to the two blood level patterns in the four levels. When there is an invasion of exogenous pathogenic qi in the upper jiao, it is the lung and pericardium that are affected. The heart is protected by the pericardium and therefore cannot be attacked by exogenous pathogenic qi. An invasion of pathogenic qi in the upper jiao may be relatively superficial, such as when exogenous pathogenic qi disrupt the functioning of wei qi. This will be similar to the wei level in the four-level model. Upper jiao heat can also be deeper than the wei level in the four-level model. Lung heat in the sanjiao model being similar to qi level heat. If the pathogenic qi invades the pericardium, it is relatively serious condition and will correspond to Yu level heat. Pathogenic qi can jump directly from the lung and wei qi aspect to the pericardium and the blood aspect. This is due to the close proximity of these two organs have to each other in the upper jiao. Wind heat invasion in the upper jiao. For a description of the symptoms and mechanism of this pattern, we are referred to the section discussing wind heat in the four levels, as these imbalances are virtually identical. This pattern's etiology can be traced to exposure to pathogenic heat. So for the symptoms and signs, there will be acute fever with mild aversion to wind and cold, no or little sweating, throbbing headache, thirst, sore throat, red swollen throat, cough, irritability, restlessness, yellowish or dried mucus in the nose. The forehead may feel warm to touch. The tip of the tongue may be red, and there may be a thin yellowish coating on the front, a rapid and superficial pulse. The key symptoms here, fever or feverish sensation and an aversion to cold, superficial, and rapid pulse. For the treatment principle, we expel wind heat and activate the wei qi. We can choose from the acupuncture points do 14, Li4, Li11, lung 7, Li10, Li11, UB12, UB13, and gallbladder 20. For the needle technique, we use draining, and cupping is also recommended. For further explanation on the choice of acupuncture points, do 14 activates the wei qi and drains heat. Li4, Li11, lung 7, urinary bladder 12, and UB13 expel wind and heat. Lung 10 and lung 11 drain heat from the lung and throat. GB20 expels wind and drains yang from the head. When there is an invasion of wind heat in the upper jiao, it is best not to eat at all or to only eat live food. The person should drink tea that is cooling and spicy in its dynamics, such as elderflower, chrysanthemum, or mint. An invasion of wind heat in the upper jiao can be caused by, there is no previous pattern, but it can in turn result to middle jiao heat, lower jiao heat, and pericardial heat. Thank you for your attention.
We discuss characteristics of the visceral manifestation theory. The term visceral manifestation first appeared in the Internal Classic. The theory of visceral manifestation is an important component of Chinese medicine and is basic to the study of the physiological functions of each of the viscera, their pathological processes, and the interrelationship between the viscera. There are three major categories of the viscera: the zang, the fu, and the irregular organs. There are 5 zang organs: heart, lung, spleen, liver, kidney. There are 6 fu organs: gallbladder, stomach, small intestine, large intestine, urinary bladder, and sanjiao. There are 5 irregular organs: brain, bone marrow, bones, blood vessels, and uterus. The zang viscera share 2 main functional characteristics. The first relates to mental activities. The various mental activities are attributed to the zang viscera. For example, the heart houses the mind, the lung houses the soul, the spleen houses intention, the liver houses the ethereal soul, and the kidney houses the will. The second is that the zang viscera house essence and qi. The fu viscera share the functional characteristics of receiving, digesting, and transforming food and drink. The plain question states, the 5 Zhang viscera house the essence and qi, but do not discharge it. Thus, they are full, but cannot be filled up. The 6 Fu viscera transform and digest matter, but do not store it. Thus, they are filled, yet are not full. This quote not only summarizes the physiological functions of the Zhang and Fu viscera, but also points out their fundamental differences. Visceral manifestation theory has its unique characteristics. To understand correctly and master its contents, the learners must pay adequate attention to the following. The first point is that in Chinese medicine, the Zhang and Fu viscera are not only morphologic units, but are also the important functional concepts and units, including many physiological functions and pathological changes. Take the Zhang organs, for example. Through their names, heart, lung, spleen, liver, kidney, are the same, though their names, heart, lung, spleen, liver, and kidney, are the same as those used in modern anatomy, in physiology and pathology, they are quite different. In the theory of visceral manifestation of Chinese medicine, the functions of a particular Zhang organ can encompass the functions of several organs of modern anatomy, and the functions of a particular organ in modern anatomy may be attributed to several Zhang and Fu organs. For example, the functions of the heart in Chinese medicine include not only those attributed to it in modern medicine, but also some of the functions attributed to the nervous system. On the other hand, some of the functions of the nervous system of modern medicine are attributed in CM to many Zhang and Fu organs, such as the heart, the liver, spleen, kidney, gallbladder, etc. The second point is the fact that CM assigns all the important physiological functions in the human body to 5 functional systems. These systems are centered on the Zhang viscera and encompass the Fu organs, the 5 sense organs, and the many tissues and non-visceral organs, each system being linked by means of its meridians. At the same time, there are relationships of generation and restraint between these 5 systems. In fact, these 5 systems, the heart system, the lung system, the spleen system, liver system, and kidney system, are aspects of the 5 elements acting in the human body. The third point is the fact that in discussing the physiological functions and pathological changes of the viscera, in general, the Zhang are described in much detail, and the Fu and irregular organs are described only briefly. Thank you for listening.
Let us go to diagnosis according to Zhang Fu organ patterns. The topic is stomach and spleen qi deficiency. Stomach and spleen qi deficiency is extremely common. In fact, it is probably more common than a pure spleen qi deficiency pattern. The etiology here is the same as that seen in stomach qi deficiency and spleen qi deficiency, that is, consuming foods that are cold or uncooked that create dampness and that are unrefined. Eating too much at a time or too quickly will also put a strain on the spleen and stomach qi. Eating too little or eating a diet that lacks nutrients will weaken the stomach and spleen qi. Although eating several small meals is beneficial for the spleen, constantly snacking will place a strain on the spleen qi because the spleen will constantly be active. Spleen qi and stomach qi can also be weakened by worrying and constantly speculating, studying, and thinking too much. Prolonged illness, excessive bleeding, and overexertion can weaken the spleen qi and stomach qi, as they will constantly have to replenish the qi and blood that has been consumed or lost. Chronic liver qi stagnation will often disrupt the functioning of and weaken the stomach and spleen qi. And finally, working or living in a damp, humid climate or housing will burden the spleen. The symptoms and signs are fatigue, abdominal discomfort, loose stools, bloating after meals, fatigue after meals, pale complexion, deteriorated sense of taste, poor appetite or a lack of appetite in the mornings, weak or tired limbs, craving for sweetness, flatulence that is not odorous, tendency to put on weight, disinclination to speak, and the voice lacks strength. The person emanates a sense of tiredness and fatigue, poor posture, a tendency to worry excessively or easily worrying about things. The tongue will be pale and swollen and possibly with teeth marks on the sides. The pulse will be weak, especially in the right one position. The key symptoms here are fatigue, loose stools, pale tongue with teeth marks, and a weak pulse. The treatment principle is to tonify stomach and spleen qi, and the acupuncture points to choose from are stomach 36, spleen 3, spleen 6, REN 12, UB20, and UB21. The needling technique is tonifying, and moxa can be used. The explanation for the points is stomach 36, spleen 3, spleen 6, REN 12, UB20, and UB21 tonify stomach and spleen qi. For relevant advice, the dietary changes are alpha and omega in the treatment of spleen qi deficiency. This encompasses both what is eaten and how it is eaten. A person who is spleen qi deficient should eat as much prepared and warm food as possible. They should avoid raw vegetables, salads, food that is very coarse, cold drinks, ice cream, and food that generates dampness, such as sweets, dried fruit, artificial sweeteners, honey, stevia, dairy products, bananas, avocados, and so on. They should avoid eating too quickly and too much at a time and whilst reading, watching television, or working. They should chew their food well and avoid drinking too much at meal times. They will benefit from eating soups, mashed vegetables, purees, porridge in the morning, stews, steamed or boiled vegetables, and baked vegetables. That is food that is easily digestible and preferably warm. The weaker their spleen qi is, the more digestible their food should be as long as it does not create dampness. Drinking a small cup of ginger tea at mealtimes will help to fortify spleen yang, thereby assisting the spleen in its transformation of the food. The use of herbs in the diet, especially aromatic spices like black pepper, ginger, cardamom, garlic, cumin, caraway, and nutmeg, will also assist in circulating qi, dispersing food stagnation and transforming dampness, thereby alleviating the burden on the spleen. Foods that are particularly beneficial are rice, oats, barley, most vegetables, especially root vegetables, squash, sweet potatoes, and those that are yellow or orange in color, red lentils, tofu, chickpeas, and chicken. It is important that the person does not regularly sit for extended periods of time and that they do not sit in a slump posture. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial as long as the person does not overexert themselves. Stroking downwards with the fingers from REN 16 to REN 8 will help stomach qi to descend. Stomach and spleen qi deficiency can be caused by stomach qi deficiency, spleen qi deficiency, liver qi stagnation, and food stagnation. And this can result in stomach yin deficiency, spleen yang deficiency, spleen qi sinking, spleen qi not holding blood inside the vessels, food stagnation, dampness, phlegm, blood deficiency, lung qi deficiency, and heart qi deficiency. Thank you so much for your attention.
Let's proceed to qi, thoracic, nutritive, and defensive qi. First, let's talk about thoracic qi, its formation and distribution. Thoracic qi is a mixture of fresh air inhaled by the lung and essential qi transformed by the spleen and stomach from the essence of drink and food. Following formation, it accumulates in the chest. Hence, the chest is called the upper sea of qi. After being acted upon by the lung through dispersion, it moves up to the throat and sideways into the heart meridian. After being acted upon by the lung through depuration, it moves to and is stored in the dantian, which is located in the pelvic abdomen about 1.5 inches below the umbilicus. Dantian is the starting point of the Ren, Du, and Chong meridians and the confluence of the entire body's qi. Hence, it is also known as the lower sea of qi. From dantian, it further enters via the acupoint qi jie, or stomach 30, the stomach meridian of the foot yang, and into the feet. The abundance or deficiency of thoracic qi directly affects the function of the lung, the spleen, and the stomach. For its physiological actions, thoracic qi has two main actions. One is to facilitate respiration by coursing through the respiratory tract. This also relates to the strength of the voice and the speech. The other is to course through the heart meridian to energize the beating of the heart and regulate the heart rate and rhythm. In clinical practice, the physician generally assesses the ampleness of thoracic qi by palpating the pulse of the apex of the heart just below the left nipple. Next type of qi is the nutritive qi. It is the chi which flows with blood in the vessels. It is closely related to blood. Indeed, though conceptually they can be distinguished, they are inseparable in reality. Hence, they are often referred to as nutritive blood. Because it belongs to yin, it is also called nutritive yin. In some respects, nutritive qi stands in opposition to defensive qi. Regarding its formation and distribution, nutritive qi derives mainly from essential qi that is transformed from food and drink by the spleen and stomach. It resides in the blood vessels and is an important component of blood, and it circulates throughout the body via the meridians. For its physiological actions, aside from becoming a component of blood, the principal function of nutritive qi is to nourish the body. It supplies the nutrients necessary for the zhangfu viscera, the meridians, and other organs and tissues to function normally. The third type of qi, the defensive qi. Unlike nutritive qi, defensive qi flows outside the vessels. Because it belongs to yang, it is also known as defensive yang. Thus, it stands in opposition to nutritive qi. Like nutritive qi, defensive qi also derives mainly from essential qi that is transformed from food and drink by the spleen and stomach. Innate qi in the kidney plays an activating role in its formation. Defensive qi is characterized by vigor, smooth and fast flow, and great power. It is not confined to the vessels but flows throughout the body, especially the skin and the flesh. It is conveyed upward by the spleen and dispersed by the lungs. Regarding its physiological actions, defensive qi has three actions. One, it guards the body's surface against attack by exogenous pathogenic evils. Two, it warms and nourishes the zhangfu viscera, muscles, skin and hair, and other tissues. Three, it controls the opening and closing of the orifices and pores and the excretion of sweat, thereby maintaining a stable body temperature. In comparison with nutritive qi, both nutritive and defensive qi derive mainly from essential qi that is transformed from food and drink by the spleen and stomach. However, nutritive qi courses in the vessels, whereas defensive qi courses outside them. Nutritive qi is yin, whereas defensive qi is yang. It is only when these two work together harmoniously that they can both act normally. Thank you for your attention.
TCM pathology of dizziness. The most important pathological distinction to be made in dizziness is that between deficiency and excess. The sensation of dizziness quite simply arises either because not enough qi reaches the head, so this is the deficiency type, or because a pathogenic factor in the head prevents the clear yang from reaching the head, the excess type. The main deficiencies that give rise to dizziness are those of qi and blood or kidney essence. The main pathogenic factors causing dizziness are liver yang, liver fire, liver wind, and phlegm. In the elderly, blood stasis may also contribute to causing dizziness. This happens especially in elderly people suffering from arteriosclerosis. Therefore, if there are any signs of blood stasis, such as a purple tongue or dark and distended sublingual veins, it is important to modify the prescription used to invigorate blood and penetrate the blood vessels. Dizziness deriving from a deficiency is slight and is associated with blurred vision. It may occur only on change of posture. When caused by a full condition, dizziness is more severe, in serious cases causing loss of balance. When phlegm is the cause of dizziness, it is associated with blurred vision and a sensation of heaviness and muzziness or fuzziness in the head, together with inability to concentrate. So here we see the flow chart for etiology and pathology of dizziness. So we have the emotional stress, overwork, and irregular diet as the etiology. Emotional stress can cause the liver yang to rise, which eventually will lead to liver wind, and this causes dizziness. Emotional stress can also cause qi stagnation, which eventually will give you liver fire. And liver fire eventually can result in liver wind, and eventually leading to dizziness. Overwork results in kidney deficiency, which means that it can no longer nourish the sea of marrow. Therefore, you experience dizziness. Having an irregular diet is a cause for phlegm formation, and phlegm obstructs the brain and prevents spleen yang from rising, thereby causing dizziness. So, in summary, the pathology of dizziness would include qi and blood deficiency, deficiency of kidney essence under empty conditions, and liver yang rising, liver fire, liver wind, phlegm under full conditions. Thank you for your attention.